Today, I wanted to take a few minutes to actually answer a few questions that have been posted and asked of me. And I've gotten several requests for doing fetal kick counts with a anterior placenta. And I actually have done some research on that, a little more research on that. And I've actually reached out to several colleagues to just make sure I'm giving you really good information and what other pearls or like words of wisdom they have. So I may be adding an additional like part 3 to this question because it is definitely a good one. So I will say that with a mom with an anterior placenta, I did just post a picture of an anterior placenta. So if you could see on that picture, that it is that uterus or the placenta is completely covering that front of the belly, right? So when you're doing your fetal kick counts, you're not going to have your hands on the front of your belly. You're going to feel your kicks either at the top part, which is our fundal part, or along the sides, or you're going to feel kicks more anterior, like the baby's kicking you in the cervix, or like the baby is kind of kicking you on your lower back, like into your lower back, depending on if the baby's breached at that moment or not. So, but that still doesn't change that we want you to still do fetal kick counts. I think moms with anterior placentas, they have to kind of concentrate more. They usually have to really be in a quiet, private place, maybe after lunch, after dinner, and after having some juice or something, and really kind of concentrate and feel for those movements. The other thing is, I guess one of the upsides to having an anterior placenta is sometimes when you come and visit your providers, we have a difficult time getting fetal heart tones because that placenta is in the way. Um, and so we often will actually take you back and have to do a quick ultrasound just to make sure that we know that your baby's doing well because we couldn't get the heart tones because the same thing, that placenta is in the way. So moms with anterior placentas usually get a little more ultrasounds than the average low with pregnancy. And the other thing is, sometimes you're coming in more for some of these NSTs, which are where maybe you're not feeling the baby move, and then we end up bringing you in and putting you on the monitor. So some of our moms that have anterior placentas, sometimes we're like, okay, we're happy to do this whenever you're not feeling movement, whenever you're feeling nervous or concerned about your baby. But it's a little easier if we do that during the workday. So sometimes at 9 o'clock at night, but you've known since 11 or a.m., but you were waiting. And then we have to send you over to the hospital to be monitored. But if it's during the day, then we're like, hey, just call us. We'll come bring you in and pop you on the monitor, let you hear the baby and let you see that your baby is actually doing well. And a lot of times with these NSTs, we'll give you a button so you can actually push when the baby's moving. So I will let you know if I have more information on this subject.